Hi guys, I'm live. Let me get a cute filter. Or not. Do we need a filter? Nah, no filter. Okay, how's everybody doing, Miner Birds? Everyone's been going live. It's been pretty crazy, right? Just seeing everyone at home, in their homes. But I'm really, really excited today because I've been having so many questions about this coronavirus and everything that's happening. And you, like me, probably have so many questions, and there's so much information out there. It's like, how do we even know who to ask or where to turn to? Where are the resources? Do you guys feel that way? And I think especially because I have little babies, I worry and wonder if I'm taking the best care of them that I can. And I got a crazy text message today saying that the whole country was going to be on lockdown for 2 weeks quarantine, and my heart literally dropped into my stomach. And actually I texted Dr. Rupie, who I'm going to introduce in a minute, and she actually told me that the national security debunked that. So if you guys got that crazy text message, just know that that's not true yet, but we still want to be vigilant and prepared. So we want to stay safe, and we want to find the best resources. So I'm gonna ask. Wait, how do I do this? I want to ask Dr. Rupie to join me. Here she is. So I'm adding. I'm gonna let her introduce herself to you guys. She's good friends with my Crystal Ponzi. There she is. Hi, Dr.
Hi.
Rupie.
Hi, how are we doing?
Good. I want to say Dr. Rupie because my name is Kimié and you have an
Yes.
IE at the end of your name. But yes, this is Dr. Rupie, Minor Birds, and she this is really random and sporadic, but I just asked her if she wanted to jump on with me so I could ask her some questions, because we all have a little bit of fear and we don't know what to do. So Dr. Rupie, do you want to just introduce yourself to everyone and who you are?
Yeah, definitely. So my name is Dr. Rupie. That's what I go by. I'm an internist. Been a board certified internist for over 10 years, practicing in Hawaii for the last 10 years. And I'm a health educator. So I am talking about COVID-19 right now because I think it's obviously very relevant and folks are looking for credible information, reliable information. I think there's so much info that's out there that's overwhelming. Even for me, when I'm watching the news, it's hard to parse through what's important, what's not, what do I need to know? We're being bombarded from every angle. So I've tried to keep it as real as possible, sticking to what we know instead of, there's a lot of Facebook posts going around. There's a lot of these text messages that are going around.
Right.
Right. Yeah. I think it's just so important that we stick to what we know and what we can do and try to avoid all of the extra noise that we're hearing. And so that's what I wanted to do with you today. I'm so glad you reached out, and I'm happy to answer questions about what's going on. So
maybe you can just start by I don't know if everyone even really knows. I honestly don't know that I really even know what the coronavirus is. Is it a respiratory disease?
So basically, the coronavirus is actually not new. We've had coronaviruses around for forever. And there are some coronaviruses that infect humans. There were about 6 until November, December, and there's a bunch that infect animals. And so what's happened is that this particular virus has gone from infecting animals and jumping species, and now actually infecting humans. So that's the worry, is that we don't really know a whole lot about it because we've never had this specific type of coronavirus. Now, the other types of coronaviruses that have infected humans in the past have been the one that the one that causes the common cold. There is one, sorry, I'm getting lots of messages. The one that causes the common, and that's also a human coronavirus. So if you look at the back of a Lysol bottle, you actually will see human coronavirus on there, but that's a different type. The one that we're talking about today is called SARS-CoV-2. Now, it's a complicated word. We're all referring to it as coronavirus, but just to kind of explain that there are a bunch of different types. Okay. This is the one that we're worried about because we don't know how it behaves. And it started in Wuhan, China. we knew that this was concerning because we saw that it was spreading around, but we were hoping that with the quarantines they were putting in place, with trying to get people to not leave that area, that it would contain it, but it didn't. And it slowly started spreading around the world, and it started getting into other countries, and obviously has come into Hawaii. And so now that we've seen it spread the way that it has, we understand just how contagious it is. There were a lot of comparisons to the flu initially. Sorry, my dog. There were a lot of comparisons to flu and how flu season was really bad this year. And to worry about this, it's not going to come here, but it has. And so a lot over the past couple of months, and now it's very concerning. We realize how contagious it is and that we do have to take this very seriously.
Yeah, and I definitely, like, for us, we're not doomsday people in my family, and
No.
so we're not like that far on the spectrum where we're like that, but we want to be vigilant, and we want to take care. We want to take the right measures to take care and prepare ourselves for what might happen in the future, because maybe we will go into quarantine at some point.
Possible.
Does that seem likely?
So I think what everybody should be planning for. So right now, I think the most important thing that all of us can do, and this is a social responsibility, because it's not just us that we should be concerned about. It's our neighbors, it's our friends, it's our kapuna. We need to be protecting everybody around us, because the worry is that this could spread so quickly, and it has. We're up to, I want to say it was about 8,500 cases in the US already. And just in the past couple of days, we've initiated more testing. There's still issues with getting people tested, and we can go into that a little bit later. But our numbers are exponentially getting bigger. And so we need to limit the spread. Now, I've talked a little bit about on the news that like 80% of cases tend to be fairly mild. They're not as big of a deal. Cases, people have a little bit of cold symptoms. You know, it's nothing that they're ending up in the hospital for. However, 20% are ending up in the hospital. Now, those folks that end up in the hospital tend to be our elderly. They tend to be the ones that have medical problems or medical
What about
conditions.
kids?
Kids don't seem to be as affected as much as the older population at this point. However, we're finding out that kids might be harboring the virus, and they might be the ones that are spreading it because they don't have symptoms. And so that's why it's so important that we're keeping that social distancing. You know, I've had to run a couple of errands and run to the hospital and whatnot. And I'm seeing people out and about kind of doing their daily thing. And I don't think folks realize just how important it's going to be to self-isolate and protect one another by not exposing ourselves. The problem is that you can be contagious without having symptoms. So people are shedding the virus even without symptoms before they get symptoms. So they're exposing other people and infecting other people. And that person, to be honest, if it's, you know, a healthy young 20-year-old, they might not get that sick. But if they get somebody who's elderly, or if they get somebody who is on chemo or has diabetes or has kidney disease,
or has the flu, right? That's why it was important to have your flu shot, because I heard that, you know, if you're fighting two viruses or something, then you're way more susceptible to be really, really sick.
Yeah. And folks who have like underlying respiratory conditions like asthma or COPD, smokers, also very high risk population. If they get exposed, then they're much more likely to end up with major problems. And our health system can't handle it. You know, I've worked all over the island. I know what our capacity is like, and all of our physicians here are very aware of our limitations. We do have shortages already. We already have physician shortages. Now, if everybody ends up getting sick at the same time, which is possible if we don't limit the spread, then our systems are going to be overwhelmed. So even if 80% of people are going to be okay, that 20% of people, that's a lot of people to try to take care of in one go. So the analogy I had given you earlier was, remember how when everybody went to the stores, to Costco and to all the stores to get everything all at once, they ran out of toilet paper, right? They ran out of water bottles. They ran out of all of these things. Now imagine that happening in the hospital. If everybody goes at once, there's not enough beds, there's not enough ventilators, there's not enough staff to take care of all of the people. So we really need to spread it out as much as possible. And I can't stress enough how important it is that we continue with the social distancing. Don't be going to the bars. I think restaurants and stuff are all closing down right now, but don't go to the gym. I've seen a lot of people going to the beach. And the problem is if everybody goes to the beach and you're in close proximity, again, you're potentially spreading. You want to keep 6 feet of distance from everybody around you. And we don't want to encourage folks that are, to be coming and visiting right now, because we really want to protect our island.
Yes. Okay, so I'm going to ask a couple questions from
Sure.
some of my
Sorry,
followers. So one question from Bree Date said, does the virus infect our food supply since it infected animals?
So it's unlikely. There's been no evidence to spread that way. So far, the main way that this is spreading is from people who are coughing. And those droplets get into the air, and those air droplets can either stay in the air for a little bit of time or they land on surfaces and then we go touch it. It might be a door handle, it might be an elevator button or something that somebody has either sneezed, coughed, whatever it might be, but they got droplets on their hands. They touch something and then you touch something, and that's
right.
the way that this is transmitting.
Hey, Mom, did you wash your hands when you came in? Wash your hand. Yeah, my mom just came over. I'm like, did you wash your hands? Because you said elevator button. Now it's like,
yes. And the 7 steps, 20 seconds, we're really getting in there. So why don't we just go through that really quick? Excuse me, it's such a basic.
Okay.
But 20 seconds isn't just doing that, right? It's not just doing that. You're getting in between your fingers. You're getting your thumbs. So you want to get in the crooks of your thumbs. And you want to get your nails. Like, you really want to get in there, because otherwise, if you're like me and you have, my nails aren't super long, but if you have nails, you can actually get bacteria and potentially virus and whatnot in your nails. So
you might as well just cut your nails too, guys.
Cut your nails, yeah.
Especially if we have kids.
Sure you're doing all those steps, getting in between, getting your thumbs, and then also even getting your wrists is a good idea as well.
Yeah, just go all the way.
Yeah, 20 seconds.
Okay, that's great. 20 seconds. And then, so as of now, there are no known children cases?
For the most part, we haven't heard of many. I think kids potentially are picking this up and having very mild symptoms. They might look like they're having a cold and we're not realizing. The problem is that we're not testing heavily in the U.S.
Yeah,
and that's because of lack of tests. And that's nationwide. That's not just here. We just don't have enough tests for everybody. And so is that because we're not testing, or is that because these kids are having very mild symptoms? Most likely they are getting it, and most likely they are mild, or they're what we call vectors, meaning they carry the virus. Okay, so I've been asked how long it could last for. If somebody gets it and they just have mild symptoms, it's going to get better and it's going to go away on its own. So what we usually recommend is that person, if they're having symptoms, anybody who's having symptoms, should technically stay on a self-quarantine. And so staying at home for 14 days, waiting for those symptoms to resolve, and they should be fine. We don't want them to be around other people. And that's something we had talked about earlier, is a lot of people live in multi-generational households, right? So you've got grandma, grandpa living in the same house as baby and toddlers and teenagers. And so we really have to separate the two, I think, right now, because our elderly are so at risk, and the folks who are elderly that are getting sick have a much higher chance of having severe disease and ending up in the hospital. We need to make sure we're trying to separate them. So right now, to be honest, if anybody's got sniffles, sneezes, making sure, coughing is the one symptom. Coughing and fever, those are the symptoms that tend to be the most likely to be related to COVID-19. But there are other symptoms that can be contributed. You want to separate them. But yeah, so far, thankfully, kids haven't been very affected, but we are concerned that they're the ones potentially spreading it.
Okay, so hi Malika. So Malika said, why is it important for people to self-isolate when they return from travel?
That's a great question. So when you're returning from travel, you have been around a lot of people, right? And we're talking about how contagious this is. And what happens is, if you return from travel, you may not have symptoms. You might have, there's potential that you've been exposed to it. You might not still have symptoms. And so you want to self-isolate, because you don't want to take the risk of having had the infection and spreading it to other people without realizing it. Because
Right.
there's been a couple of people that I personally know this has happened to, and you can't imagine the guilt that they're feeling that,
Right.
oh my gosh, I brought this back, right? Like,
Right.
and they're giving it to other people, because so many people can be infected from one person who might not be symptomatic.
Right. And, you know, like, we're talking, guys, so this is Dr. Rupie, if you guys are just joining us, and she's a health educator and a doctor for over 10 years. What kind of doctor did you specifically say?
I'm an internal medicine specialist.
Internal medicine. What does that mean?
I work in the hospital. I work in the hospital. So I'm an acute care physician, meaning anything that comes into the hospital, pneumonia. So we're basically frontline for COVID-19. So pneumonias, heart attacks, strokes, those are the types of things that I take care of in the hospital. And I've worked all over the island.
Okay. And let's talk about, you're pregnant.
I am.
Yeah. Doesn't she look amazing, you guys? Is this your first baby?
It is my first baby. Yeah.
Amazing.
Yeah.
Amazing. So what are your thoughts, my mama birds who are pregnant? Oh, sorry. Right. So what are your thoughts, or like, what can you say to those as a pregnant woman living right now in this time? Like, is there any advice that you can give on how to stay safe and things like that?
Yeah. So for pregnant women right now, it's a really uncertain time. There's been a couple of studies on pregnant women in China who ended up catching COVID-19. And
oh my gosh,
tended to have milder illnesses. Yeah. I mean, it's bound to happen, as contagious as this is. Because they're younger, it seems that they've tended to have milder illnesses and that their infants have been okay. However, if they were to catch it and the infant, let's say, there's birth, delivery, there's baby, you would have to self-quarantine yourself from the baby for 14 days.
Oh
so
my gosh.
For me personally, so that would not be an ideal situation. So that's why all of these precautions and these measures and all these things that we're doing are so important. And I personally am trying to, use all of the precautions that I can, the constant hand washing, trying to avoid touching my face, definitely, limiting any going out and whatnot, because I don't want to take those risks. Obviously I work in a hospital, and so that would, be a concern, but we take the appropriate precautions that we can. One thing
Do you wear a mask?
Well, so one thing I will mention is that we're running out of masks at hospitals, and we're running out of protective equipment. This is all over the U.S. This is not just in Hawaii. We have limited supply, so it's really important that folks are not hoarding this stuff, because, the folks at the front lines are the ones who really need this to be able to take care of everybody. So we are right now, obviously, we're taking the precautions that we can. The worry is if we hit the kind of that plateau that we're worried about, if everybody doesn't take these precautions, then there's a risk that we run out. And what we do then, reusing masks and reusing things, that's going to be the way that we have to handle it. But it is very concerning. So
yeah, definitely. Okay, I have a question from.
I think, for pregnant women taking the extra precautions, one of the questions you had asked earlier was about disinfectants. And so I definitely want to touch on that as well, because keeping your environment very clean is important. The places that people are touching frequently, you want to disinfect, because you want to try to, if anybody's, coming home, whatever, you want to make sure that you're cleaning those surfaces. I'm going to post a list. It's actually from the CDC, and it's also from the EPA.gov websites. So they're constantly updating over there, but I'll also put that list on my own website. So you can go to drrupie.com, and I will have that list in my coronavirus updates.
Great, and I will post that right now as well, so you guys have it right there, drrupie.com.
Thank you.
Can people get the COVID-19 more than once?
So it's still really early to tell. So this is an illness that's only been around for several months at this point. That is all we know about it. And so I can't stress enough that the situation is evolving. We're learning something new every day. If you had asked me these questions a month ago, and I was actually on the news talking about this a month ago, we're in a very different situation today than we were a month ago, or even a week ago, or even a day ago. So things are constantly changing.
More knowledge, you mean?
Sorry? Knowledge, yeah. So
There's more knowledge now? Okay.
Yeah, just understanding what this virus is doing and what it has potential for. You know, getting reinfected at this point, it's definitely a possibility, but we don't know for sure. People do develop antibodies when they do get infected, but is that enough to not get another infection? It's tough. It's tough to say at this point.
Got it. So yeah, so just because I'm a mom and like for anyone out there that has kids, what are some things, other things we can do to kind of keep the environment safe? Or, you know, you said wiping down the areas, surface areas that are frequently used. So I'm
Yep.
thinking door handles, all the
Yep.
drawer handles, like tables and things like that.
Yes.
What else can we do to
So I think
protect?
in general, the guidance is staying at home as much as possible right now. You really don't want to be leaving to do, you don't want to be out and about. I think that is the one thing I want to stress right now is share this with your friends, share this with your family, especially if they're not taking it seriously, because I think there is a lot of doubt and there's a lot of thought that this might be media hype and whatnot. But I think most importantly is that we are somewhat quarantining ourselves. I know that message that had gone out, you know, folks were concerned that, oh, what is this? The message from Trump, or I guess it was a text message that was circulating on social media. There is a chance that we might be asked to stay in one place, meaning staying at home. And if you were to get quarantined, you do want to be prepared. So if let's say you were accidentally exposed to somebody who had COVID-19, you might be asked to quarantine yourself for 14 days. So being prepared for the 14 days. It's not doomsday. We shouldn't be panicking, but we should be very informed and we should be prepared. So what do you need for those 2 weeks? Making sure that your kids have supplies, making sure that you've got access to diapers and hygiene products and things like that, along with food and what you would normally think about. For our elderly and even for our kids, we want to make sure that, oops, I think it went. You want to make sure that they have medications if they need medications. And then another thing that we don't think about often is in case they have cough and cold symptoms, making sure that you have Tylenol on hand, you know, cough and cold remedies, so you don't have to run out to the store to go grab those if you are on quarantine. Let me try to think. Other things that you can do for kids. Right now, they're on spring break. You don't want to be congregating them together. They need to be separated right now. You know, come up with games, come up with activities for them.
I'm actually working on something online so that we can share, you know, how crazy is it that everyone's been going on live? You know what I mean? Like, thank God we have this. I got to FaceTime my grandma yesterday because I'm not going to bring my kids around her, but she misses them. So, I mean, the power of the tools we have today, you know, there's a way for us to be self-isolating but still feel connected and in a community. And, you know, for me, I don't want people to live in fear. I just wanted to do this with you to give that information from a resource, you know, a trusted resource. Oh, I'm going to show them your website real quick. Okay, so this is Dr. Rupie's website. Look at her dog. Is that the dog that was barking?
Yeah. Where'd you go? Oh,
and then here, I click here, the red bar, right? And that should take me to the list of resources.
The list of resources should be at the bottom of that page right there, that download button.
Oh, right here.
Yep, that's going to be your list. And that's from the EPA.gov and the CDC, but that's your list of disinfectants.
That's amazing. Oh, it says the file was not found. So good thing I tried that. Yeah. So this is the list of disinfectants that work against SARS-CoV-2. Cool. And then I see you have a bunch of other information on here too. Yeah, so that's great. There's a lot of information
on there. One of the things that I do want to mention is the importance of knowing what to do and knowing the symptoms in case, let's say, somebody in your household was to get COVID-19. So the most common symptoms and the symptoms to look out for are very similar to flu. But if you have a fever, a cough, and shortness of breath, you need to get checked out. And so, and at this point, it's not just the folks that are traveling. At this point, we are concerned that there is likely community spread. We haven't been able to definitively prove that. I think there was a recent case that they're looking into that there might be community spread, meaning that somebody traveled here, brought it here, and somebody here gave it to another person here. And so if that is actually, if that is happening, then you should know what to do in that case if you ended up with a fever, cough, or flu-like symptoms.
So
So
do we go to we go somewhere? We go to the
so
doctors?
there's different steps. So let's say I ended up with a cough, and I ended up with a fever and I want to get checked out. The best thing to do is probably call your PCP. If you can't contact your PCP, or there's a lot of folks that might not have a PCP or might not have insurance, I actually work on a platform that's a telehealth platform. Now, what telehealth is exactly what we're doing right now, where you get to see a doctor over video conference. You can do that
Amazing.
you can do that on your phone. You can do that on your computer. The platform I work on is called We Prescribe.
Okay.
So if you want to add that below, but weprescribe.com. And you can go to that. Your insurance company might have one that you can go to as well. I know there are currently, obviously, wait times and whatnot because of the situation, but that's going to be your first step, is to contact either your PCP or get onto telehealth and be screened or have them triage whether or not you need to go and get testing. Because the thing you don't want to do is be showing up to a testing center without symptoms, and overwhelming the testing center, or even exposing yourself without need, because you don't want to show up there and somebody else have COVID and then you're around them when you actually just have mild symptoms, or you might not have any other problems. Now, other medical problems, so we're seeing a lot on our platform. We're actually seeing a lot of people who need medication refills, people who can't get into their PCP's offices, people who have others, like, sometimes we see people with the, urinary tract infection. It's just bad timing. It's happening right now when all this is going on. You don't want to go in to be seen in person. You can do this virtually over a video conference, and it's very quick and easy.
This is it right here. We Prescribe.
Yeah. The other thing is, if you're having symptoms and you start to develop shortness of breath, chest pain, confusion, or just feeling overwhelmingly unwell, having chills or anything like that, then go to the hospital. But you want to call on your way, because they need to be prepared for any COVID cases. So call on your way. If you call 911, let them know I'm concerned about COVID, so that they can prepare on their end.
Yeah, that's great. I mean, especially what you said about, there's, is there anything we can do to help, like, keep healthcare workers safe, or is there anything that we can do as a community?
Yeah, so I think that's one of the major things, is don't go into the hospital unnecessarily right now.
Okay.
We want to keep the hospital as free as possible for COVID cases, and emergency cases. So anybody who's needing emergency help. So if it's something that you can handle at home, via CP or via telehealth, that's the way to do it right now. That's going to help protect them. That's going to help protect also. Notifying them if you are worried about COVID, so that they can take the appropriate precautions. Lastly, not hoarding face masks. That's out there, and somebody's got like a big stockpile, contact the hospital. I mean, it's so frightening to me that we're running short on just N95 face masks. Protect the folks that are at the front lines of this.
Yes.
And I think
on behalf, oh my gosh, I have chills.
Yeah. The folks, on behalf of everybody standing at the front lines of this, please just stay at home. Something I had posted on my Instagram is, we've got people who are willing to put their lives on the line. They're willing to put their health on the line, to put their families at risk by going into the hospital and taking care of everybody, especially in the with the potential of what could happen. If they're willing to do that, then the least that everybody else can do is to stay at home and watch Netflix and hang out.
Or like, I feel like this is the perfect time to like self-reflect and do that thing that you've been talking about doing for months and years and whatever. Like, read that book, like dust the dust off of your book and read a book, or like, you can catch up on Netflix too. That's fun. But like, I really feel like this is a great time to do other things. Okay.
Self-care.
And then, self-care. I was just thinking, like, so if we can't go to the gyms or we can't really get out, what are some of the things we should be doing? Obviously, isn't that part of like the prevention, is like drinking water, trying to exercise?
Absolutely. And there's a lot of great, if you're on social media, there's a lot of people putting out exercise routines that you can follow at home, and people are coming up with great ideas for activities and things for you to do at home. And meditation is another thing that you can take up. Just self-care at this point. This the situation's stressful. I think it's just as stressful for everybody at home as it is for us in healthcare, you know, and so it's really important that we're taking care of our mental health as well during this, because, you know, that stress isn't healthy either. And the more stress we have, the lower our immunity is. So we really want to make sure that we're staying healthy, we're taking care of one another. Check on your neighbors, call them, check on anybody elderly that you know, making sure that we're trying to, this is a time that we can take care of one another and really help each other out. And so I just think it's our social responsibility to be doing these things, staying at home, checking on everybody, making sure everybody has supplies. If you've got extra toilet paper and your elderly neighbor doesn't, please share. You know,
we're almost out. I'm like,
yeah,
oh my gosh.
I didn't go with the rush, and
me neither.
You don't want to go with the rush because that's a bunch of people. Again, you don't want to be gathering around a bunch of people. And so these Costco lines are just, you know, when I've seen them, it doesn't make sense, because we're trying to be distant, we're trying to self-isolate, and unfortunately, it's just, I don't think that message has gone out there wide enough. And I would love for anybody who's on this call right now, just to share with your family and friends how serious the situation is, to just be prepared. I'm not trying to induce panic, but I think that looking at what's happened around the world, if we look at what's happened in Italy and what's happening in Spain, I mean, it is a very concerning time. And I think it's just, I can't stress that enough, that we really need to take care right now so that we can flatten the curve, so to speak, so that we don't end up with a mad rush of patients in the hospital.
Right. Yes.
Yeah.
That's the thing. So let me see if I have any other. Oh, okay. So here's a question. My father is 83 and is currently ill with an infection in his shoulder. I know his immunity is low. How do I keep him safe and us as well? So self-isolation, we know that. Is there anything else?
Yeah. You know, even in the home, so identifying a place that the older folks can kind of just hang out for 2 weeks, that they're not really exposed to others much, limiting interactions, especially if there are kids in the house. That's one recommendation. Again, making sure to disinfect the areas. I really, for the elderly folks or the immunocompromised, I would not be going out at all right now. I think for the next couple of weeks, hunker down. That's going to be.
And you mean everyone in that house shouldn't be going out, like, because.
And there are circumstances where you have to go out. I completely understand that. In those circumstances, making sure that you're keeping 6 feet of distance from anybody around you. Like, let's say you have to stand in line, or let's say you have to be, you know, at work, and you have to, you know, everyone has things that have to continue to happen. So making sure you're keeping that 6 feet of distance, washing your hands, not touching your face, and using disinfectants after you get home, or any surfaces that are being frequently touched if you are at a workplace or whatnot. So taking those precautions. And if you're sick at all, if you've got a cough, and I know some people are saying, oh, but I've got allergies, so I'm sneezing and people are looking at me funny. In general, whatever fluids are coming out of you need to go, if you don't have a mask, into the crook of your elbow, or wear a mask. If you have, like, bad sneezing or bad coughing, anything, if you have to be in public, wear a mask. But if you're sick, if you've got a fever, you got to stay home.
Yeah. So what about moms? Like, a few of my friends just had babies. So is it sort of just the same thing just for everyone, whether they have brand new babies?
Yeah. Brand new babies, immune systems aren't developed. They have their maternal protection, but the worry is that the moms haven't been exposed to this before. So there aren't going to be those antibodies that normally would protect the infant. So, we're not seeing, high infection rates, but there's always potential. So you really, really want to keep them protected and keep them away from others. So that's staying at home, social distancing. If anybody wants to come see the baby, not right now, you can FaceTime.
Right. Yeah. Wow. Okay. Yes. Woo. Anybody have any other questions? Yeah. Let us know if you guys have any other questions too. I really like that weprescribe.com. That's great. I'm probably going to use that for anything I have if I need to.
Yeah, it's really good. It's easy. It's simple. You can jump on the website, or you can download an app and just do it on your phone. And
Amazing.
so, yeah, and there's a bunch of there's 20 docs that work on the platform, so we're available.
Hi, everybody. Hi, Alana. So I know Alana, she just had a brand new baby, so
Okay.
she's watching from home. Hi, Alana. And aloha, everybody, for watching. If you guys just tuned in, this is Dr. Rupie, and she is working on the front lines with cases. So have you already worked with people who have had this?
So luckily, I have not had an exposure. So
Amazing.
yeah. So far, I think we have. Gosh, are we up to? I haven't looked this morning to see. I know we were up to 10 cases yesterday. I want to say we're up to. I know the Lieutenant Governor just posted.
Is this for testing?
No, for positive cases. How many
Oh,
positive cases we have in the
I
island?
see.
We're still under 20, but we have been seeing doubling of numbers on the mainland. So we can kind of expect to see that here because, like I said earlier, we just haven't tested
The testing.
enough people because we've been very limited. Initially, the testing requirements have constantly been changing. Like I'll kind of reiterate what I said early on is that this situation has evolved so much. It's evolving and changing every single day, sometimes by the hour. We're learning a lot, but this virus and this disease has only been around in humans since around December. So that's all we know about it. You know, like things like the flu and, you know, all these other illnesses, they've been around forever. We know so much about them. Whereas this is something that's brand new, and that's why it's worrisome, and we're trying to
take your precautions.
Yeah. So taking
Okay,
those precautions is key.
So, okay, so what's the methods and equipments being used during the testing that's running out?
The method. So it's a nasopharyngeal swab. So what that means is they're going to put a swab through
All
your
the
nose,
way up.
yeah, all the way up, and get a swab back there. And that testing basically is going to go into a protective. Have you ever had flu test before?
It's the same thing?
Yeah, it's the
Okay.
same thing. And then that gets sent out to a lab. Now that takes time for it to come back. If you have been tested for COVID-19, you need to self-quarantine yourself until you get the results back. So if you do go, let's say you've got fever, cough, you get the swab. From there, you need to quarantine yourself, meaning isolate yourself not just from the outside, but from your family members as well. So you're going to want to have your own designated room and space in your house that you're staying away from everybody. So
For 2 weeks.
For 2 weeks. Well, if your test comes back negative, I think they are allowing. Personally, if you've got a fever and cough, I would quarantine for 2 weeks because everything keeps changing so frequently. But the guideline is until you get that test back. Now, the problem is, and you don't want to go get tested if you don't have symptoms. Tests are coming back negative when people don't have symptoms. And then they could potentially come positive when they start to have symptoms. So
that has happened. I read about that.
Happened. Yeah, so you don't want to be going to get testing unnecessarily. You don't want to go show up at one of these 40 some odd testing sites that we have on island without symptoms, because even if you get the swab, it could come back negative, but you don't have symptoms yet. Or some people are just because they're scared or they're worried. Swabs, please don't do that. We really want to be saving these for the people that we think actually have it.
Yes. Yeah, so that's what someone was just asking. What's the incubation period? So it's about how long?
Up to 14 days is what they're saying so far. You know, I've read reports it could be a little bit longer than that, but we're kind of sticking with the 14 days right now. You know, as far as the potential incubation period. And it seems like symptoms are starting out really mild and subsequently getting worse. So, you know, folks might be feeling completely fine even with the infection. So we again, there's just so many uncertainties, so many things that are not known about this that we need to take it seriously, plan for quarantine. We need to try to isolate, you know, social isolation, social distancing. All of those pieces are important.
So when you say quarantine yourself, like, can you just explain what that means?
Yeah.
Like, okay, you pick a room and then what? Oh no, what happened? Yes, honey. Yes, Omel. Yes. Hi, honey. Is everyone there? Oh, Dr. Rupie froze. Hi, you guys. Are you guys still there? Give me a heart if you are. Where's Omel? You're so loud, Omel. When is it safe for kids to go to school on a normal basis? So I just heard that schools are going to be canceled till at least April. Um, so yeah, that's pretty crazy. I think Dr. Rupie might have lost service, so I'm sure when she comes back, I'll add her back on. But isn't this crazy, you guys? And I'm not doing this to give you guys fear. I think that knowledge is power, and the more that we know, the more we can prepare ourselves, the more we can be vigilant, the more we can protect our families. And so that's really all I wanted to do with this is just, I have a lot of questions, just like all of you, and I want to do what's best for my family and obviously our whole community, the world. So, oh wow, a lot of schools have closed for the rest of the school year, actually. Which, yeah, I guess most schools get out in May, so they're just canceling school altogether. But yeah, I think this is a good time for us to self-reflect and, like she said, take care of our wellness so we can do meditations. I meditate. Um, I try every day. I don't get to do it every day, but I have my Calm app, and you can get that at the App Store. I use it as like a sound machine too for Omealeni every night and for all her naps. And like LeBron James has his playlist of like rain falling on the leaves, and he has his own series on there. They this app, Calm app, they work with a lot of successful people, and these people share how these things actually help them to stay well and to be able to perform at such high levels. What? Mommy, grab my ball. Oh man, it's still got green. Go get your ball. Go down and get it. Or do you want to go in your room? Hi, you guys. Oh, so Kauai is on vacation and now they have a curfew. Oh, wow. So your mayor in Kauai just told you guys this? That's crazy. Um, I don't know if Dr. Rupie's coming on. I feel like I need to text her. Hi, Justine. So, okay, go honey. So yeah, this is all just crazy. I'm just wondering, okay. Come on. I'm just wondering when we will be on quarantine or have a curfew. And, my partner is still out there working every day. So I think I'm just going to have to do a lot of disinfecting and wiping. Thank God my kids were sick. It sounds weird to say, but thank God they were sick the last couple of months. So I had all this stuff. I had hand sanitizer. I had masks. I had the wipes. Like I had everything I needed for this time right now because they were sick. And I have all the medicines that we need. Pretty crazy. San Antonio gym, bars, restaurants are pretty much closed. Yeah, here in Hawaii too, our governor announced that all restaurants have to be closed except for to-go orders, takeout, and all the bars are closed. Mom, is he sleeping? Where is he? Oh, I don't see my baby. Hi, you guys. Aloha, Maui. I'm not sure what happened to Dr. Rupie. Let me just text her real quick. Good thing we have. Here I am. Hi. So, yeah, we're just trying to figure this thing out. It's really been crazy. Um, but I just want you guys to have the information so that we can help stop the spread of this virus. And I hope that, oh, there she is. Dr. Rupie's back. Yay. Okay. I'm going to add you back on. How do I do that? Or can you request to join? We're just going to have if you guys have any more questions, here she is. There she is. Okay. Yay. Aloha, you guys. I'm wishing you all love and aloha and light.
Hey, sorry about that.
Hi.
My phone died.
I don't see you. There you are. Okay.
Hi.
Hello. You're back.
I'm back. Sorry, my phone died. How to plug it in.
This is real. Cool. Yeah, I was just talking stories with them. Hi, Tiare from the Silva Shop, and we have Georgia here. And people were just telling me that some of their restaurants are closing, and delivery only gyms, bars, restaurants all closed in San Antonio. So yeah, it's happening. Oh, and then someone said congratulations on your first child.
Thank you.
Yes. So was there anything else that you wanted to share on, you know?
Yeah, no, I think I kind of went through all the steps that we can take. Again, just to kind of reiterate, we're all in this together. Those of us that are in healthcare humbly request everyone to just heed the precautions and the requests for social distancing. I think that's a really important piece. I know I was a little bit concerned when I saw folks going out for St. Patrick's Day and kind of social gatherings that I've seen taking place. And so just making sure that we're taking this seriously. This is a serious situation. I know I've heard a lot of people ask, actually a lot of friends have reached out to ask me, is this all media hype? Do we need to be concerned?
Right.
And as a local physician and someone who speaks to and talks to and knows a lot of physicians, we're all very concerned. And so if we're this concerned, the community should be concerned as well and be taking those precautions.
Definitely.
And then the one point I do want to mention is just sticking to reliable sources. There's so much going out there on Facebook and Instagram, and unfortunately people use this as an opportunity to push agendas that might not necessarily
Right.
I think the celery juice guy is pushing to drink celery juice and buy his book and things like that. And, that unfortunately, there are unscrupulous people out there, and you just really need to focus on the reliable places for information, which are the CDC and the WHO. They are constantly updating every day, and they have the most up-to-date information. If you're concerned or wondering about something, they've got great answers on their webpage as well. They go through myths, commonly thought of myths and some of the questions that people have about does temperature affect COVID and things like that. They actually go through all of that on their
That's
website.
at the who.int.
Yep, that's the one.
Okay.
Yeah.
I'll show that right now.
I think it's yeah. They're fantastic. They've got all of your questions and all of your concerns. You can put them in the search box, and they have really reliable information, and so does the CDC.
Amazing. Because I'm sort of geeky like that too, where I start just, we instantly go Google and we just type things in, and then we don't even know if it's reliable or where this is coming from. And like you said, people are going to push their agendas and things like that. They're going to use this crisis as a time to do stuff like that. So, and what is CDC? What's the other one?
It's cdc.gov. I think is I don't have my computer in front of me anymore. But I'm pretty sure it's cdc.gov. And on Instagram, you can also follow them on Instagram. I think there's a CDC.gov on Instagram as well.
Great. I'm just putting it right here in the comments, you guys.
CDC, and CDC stands for Centers of Disease Control, I believe.
Centers of Disease Control.
Yeah, and they're our go-to resource, even for hospitals, even for the state, even for us as individual healthcare practitioners. We all use the CDC.
Amazing.
Yeah.
Oh, this is so helpful. I hope this helped you guys
so
as much as it helped me, because, yeah, I'm going to just show this is the other website that she's talking about. And
I see a quick question that says, what kind of cough would you get? The cough tends to be dry. It tends to be a dry kind of hacking cough. Okay,
that's good to know.
Yeah.
So it's not productive. It's not like you're bringing stuff up.
It doesn't tend to be. Again, there are people that can have various symptoms, but it tends to be a dry cough with fever with shortness of breath. Those are your classic your more classic symptoms. Now, not everybody is the same, and you know, folks definitely have different presentations, but those.
Sorry, she's over here.
Oh.
Okay, thank you so much, you guys. I will save this to my story, and I'll probably post this up on like Facebook, and I'll give it to you so you can post it too. You guys can check out her website, drrupie.com, and she has lots of information too. And then maybe you can also put those links up to those other websites that you mentioned. The one that I like was the We Prescribe. That's great. For online doctor visits, so you can just do it like this, and then also the CDC and the WHO.int. Those would be great, like for resources.
Definitely, I'll put it on my website, stories, and on my Instagram. So I'll continue to do that as well.
Yeah, so just follow her, Dr. Rupie. She can be a creditable source, and I really like that you're about educating, health education, right? And I love that. Idea so that we can help take care of ourselves.
Yeah, it's empowerment. It's self-empowerment. The more you know, the more you're able to take care of yourself. And so I think I'm happy to answer whatever questions I can. If folks have reach out. Private messages I don't always get, so just comment in whatever.
Okay. Thank you so much. Appreciate
welcome.
you.
My pleasure.
Take care.
Take care, guys. We'll see you.
Aloha, everybody. Bye, Miner Birds. Wash your hands.
Yeah.
Bye.
Bye.